Pneumonia is a lung infection that can be minor or serious enough to need hospitalization. It occurs when an infection causes your lungs' air sacs, called alveoli by your doctor, to fill with fluid or pus. It may be difficult for you to breathe in enough oxygen to enter your bloodstream as a result of this. Pneumonia can affect one or both lungs. You can also have it and be completely unaware of it. This is described as walking pneumonia by doctors. Bacteria, viruses, and fungus are some of the causes. You can transfer pneumonia to others if it is caused by bacteria or a virus. Smoking cigarettes and consuming excessive amounts of alcohol might also increase your chances of contracting pneumonia. Your symptoms can vary depending on what's causing your pneumonia, your age, and your overall health. They usually develop over several days. Common pneumonia symptoms include chest pain when you breathe or cough that produces phlegm or mucus, fatigue and loss of appetite, fever, sweating, and chills, nausea, vomiting, and diarrhea, shortness of breath. Along with these symptoms, older adults and people with weak immune systems might be confused or have changes in mental awareness, or they might have a lower than usual body temperature. Bacteria, viruses, or fungi can cause pneumonia. Common causes include flu viruses, cold viruses, RSV virus, the top cause of pneumonia in babies age 1 or younger, bacteria called Streptococcus pneumoniae and Mycoplasma pneumoniae. Some people who are in the hospital get ventilator-associated pneumonia if they got the infection while using a ventilator, a machine that helps you breathe. If you get pneumonia while you're in a hospital and aren't on a ventilator, that's called hospital-acquired pneumonia. But most people get community-acquired pneumonia, which means they didn't get it in a hospital. Your doctor will begin by asking you about your symptoms and medical history, such as if you smoke and if you've been around sick individuals at home, school, or work. They'll then pay attention to your lungs. When you breathe in, they may hear cracking, bubbling, or rumbling noises if you have pneumonia. If your doctor thinks you might have pneumonia, they'll probably give you tests, including blood tests to look for signs of a bacterial infection, a chest X-ray to find the infection in your lungs and how far it spread, pulse oximetry to measure the level of oxygen in your blood, a sputum test to check the fluid in your lungs for the cause of an infection. If your symptoms started in the hospital or you have other health problems, your doctor might give you more tests, such as an arterial blood gas test to measure the oxygen in a small amount of blood taken from one of your arteries, bronchoscopy to check your airways for blockages or other problems, a CT scan to get a more detailed image of your lungs, a pleural fluid culture, in which the doctor removes a small amount of fluid from the tissues around your lungs to look for bacteria that might cause pneumonia. Pneumonia can have complications, including bacteremia, in which bacteria spread into your blood. This can cause septic shock and organ failure. Trouble breathing, which might mean you need to use a breathing machine while your lungs heal. Fluid buildup between the layers of tissue that line your lungs and chest cavity. This fluid can also become infected. Lung abscess, when a pocket of pus forms inside or around your lung. Your doctor will be able to inform you which treatment option is best for you. Antibiotics will be given to you if you have bacterial pneumonia. Make sure you finish all of the prescription prescribed by your doctor, even if you start to feel better before you finish it. Antibiotics will not assist you if you have viral pneumonia. You'll need to relax, drink plenty of water, and take fever treatment. Your doctor may refer you to the hospital if your symptoms are severe or if you have other medical issues that make you more vulnerable to complications. Your doctor will most likely give you water or antibiotics through an IV tube while you're there. It's possible that you'll require breathing treatments or oxygen therapy. Recovery from any type of pneumonia takes time. You'll need to get plenty of rest. You may require a week away from your typical habits, and you may continue to feel fatigued for a month. Have you learned something? Well, now that you've learned about pneumonia, you don't have to worry anymore. Let me know what you want to learn next. Comment down below.